The province is seeing a rise in RSV and measles cases, and that has health professionals worried for children, the elderly, and those with chronic health conditions. Vaccinations are effective to prevent both RSV and measles. And joining us now to tell us more is Britt Kural with Pharmacists, Manitoba. Good morning, Britt.
Good morning.
Thanks for joining us.
My pleasure.
Now, RSV is really dangerous for kids. We know that, for infants especially, but it's also really dangerous for 60 plus, right? Tell us why.
So we've known for a long time that RSV is a risk for children, and it continues to be, and there are strategies in place to help minimize those risks. But we also know, and more recently over the last 3, 4, 5 years, really due to better diagnostic tools and better screening, that RSV is actually affecting older populations far more than we would have expected previously.
Okay, so before we continue with that, what is RSV exactly?
So it's a virus. It is similar to the flu in many ways in that it circulates and causes the biggest burden of illness this time of the year. So usually what we consider to be the flu season, so like October through March, when colder seasons are affecting us in North America and we're inside more than outside a lot of times. And it can present very similar to flu in many cases. So a lot of people will feel tired, run down, sniffles, coughs, that sort of thing. But it can progress to more serious illness in older adults and people who have underlying medical conditions.
Okay, and so for the little ones, you know they're really sick because they're struggling to breathe, right? Is that how you know they're in danger?
Yep, that is definitely one of the complications of RSV, and the same thing can happen in older adults as well.
Okay, so how do you prevent it from happening, and what can you do to protect yourself?
So there is a vaccine that's available for RSV. There are 2 vaccines actually out on the market, and both of them can be very helpful for older adults or individuals, adults who have underlying medical conditions such as asthma, COPD, diabetes, or diseases that affect their immune system.
Okay, and so in an average year, 23,000 60-plus adults have had RSV in Manitoba.
Yes, that's a stat that I have seen recently. 23,000 Canadians who are 60-plus hospitalized on an annual basis with RSV. Some of those stays might be short. Unfortunately, some of them can be long and require intensive care.
And some can be deadly.
Absolutely.
Okay, so that's the best way to protect yourself with that. We're also seeing a rise of measles cases in Manitoba. In fact, Manitoba is seeing the highest numbers in the country right now. What is measles and why is it so dangerous?
So measles, again, is a viral infection. It's highly contagious. And it has been a viral infection that has been relatively well controlled in North America into the last year or two, unfortunately. It's vaccine preventable, and it's completely free of charge to receive a vaccine in Manitoba. Highly recommended. So individuals as young as 6 months old can receive a dose in many cases, but absolutely children a year and up should be getting at least 2 doses as per the schedule recommended by public health. And any adults who haven't received their full course of vaccines, so 2 doses, should also be getting a booster.
There was a potential of a super spreader in Brandon just a couple of weeks ago where there's many cases that are coming forward now where there are people infected with measles. It is so dangerous and it's so spreadable because it's just droplets in the air, right?
Absolutely, and you could be spreading it before you even know that you're sick. And that's the really scary part about measles is you can be spreading measles 4 days before you even know that you're sick.
Wow.
So really vaccine is the best way to help prevent it. We don't even think quite often about the long-term consequences of being infected with measles because it's been such a well-controlled disease public health-wise for many, many years, decades. But it can also cause some really very serious long-term consequences when you get measles, and it also can, unfortunately, in many cases, cause death.
Okay, and so this is not something you can just go to the pharmacist and get a vaccination. You need a prescription from your doctor, right?
So it's not a prescription. You would need to go to public health, either see your doctor, your nurse practitioner, go to public health to receive that dose. That's not available in pharmacies. RSV vaccines, you could get a prescription from your physician, your nurse, and take that to a pharmacist, and it could be injected, and you can be vaccinated by a pharmacist there if you wish.
Any other advice for the public?
You know what, I think the other thing to keep in mind with RSV vaccines and with other general viral infections is we can't play down the importance of just common sense things around viral infections.
Okay.
Practicing good hand hygiene.
Right.
Staying home when you're sick. If you have to go out and you're ill, wearing a proper fitted mask to help minimize the risk of spreading those droplets and causing illness to others.
Britt, thanks for your time today.